Suppose I told you you possess the single most powerful medical diagnostic tool to get and stay healthy. What's more, suppose I told you that use of this tool doesn't depend on whether your doctor is in network or out of network. You don't have to reach some deductible before you can use it. In fact, use of this tool isn't tied to your health insurance at all. But wait, it gets even better. Suppose I told you that you can increase the effectiveness of this tool at any time. So what is it? What is this powerful diagnostic tool that you already possess? It's your voice. Your ability to effectively communicate with your doctor is the single most powerful diagnostic tool you have to get and stay healthy. But what happens when that voice isn't effectively used? When a patient's voice isn't heard, either because it's disregarded or the words just don't come out? When that happens, it causes tens of millions of Americans to suffer unnecessarily every year. It causes emergency room visits and misdiagnoses that cost our healthcare system over $300 billion each year. And when that happens, it creates a silent dissonance over treatment decisions that place a tremendous emotional and physical strain on patients because they feel their voices aren't being heard. I'd like to share with you one of those stories, one of those voices. His name's Peter, and Peter was in my health law class. I saw Peter on Wednesday nights from 6 p.m. to 9 p.m. Peter was a very good student, came to class on time, turned in his deliverables, was actively engaged in class discussions. Afterwards, we talk about his marathon training. Over the course of the term, I watched Peter go from that engaged, prepared student to someone who missed class. And when he was there, was so exhausted he could barely keep his eyes open. So I asked Peter, "What's going on?" And he said, I don't know. I went on a training run and I found a tick on my thigh. Knowing that ticks can carry Lyme disease, Peter saved the tick, made an appointment with his doctor, and wanted to discuss it. During his 15-minute appointment with his doctor, he explained what happened and showed him the tick and asked him to have it tested. The doctor looked at him, kind of laughed, and said, "We don't do that. Come back when you develop symptoms." A couple weeks after the bite, Peter started to feel achy, developed reoccurring fevers, felt exhausted, and generally run down. He made another appointment. This time, his doctor came into the exam room carrying his laptop and proceeded to run through a series of Lyme disease indicator questions. After checking a series of appropriate boxes, he asked Peter, "Have you developed a bullseye rash?" which, according to his laptop, is a definitive sign of Lyme disease. When Peter said no, his doctor said, "Come back if and when you do." Now, at this point, I have to interject myself into the story. By now, Peter had withdrawn from my course. With the demands of work and battling extreme exhaustion, he couldn't keep up with the course deliverables, so he withdrew from my course. We kept in contact with email, so I can tell you what happens next. Several weeks later, Peter developed a 105-degree fever and couldn't walk in a straight line. His friends took him to the emergency room, and the medical staff started running tests. While there, Peter repeatedly voiced his concern that he had Lyme disease. But the medical staff said, "Hey, for that to be the case, you would have the rash." Fortunately for Peter, before he was to be discharged, the rash appeared. It was only then that Peter's voice was heard. The medical staff treated him for his Lyme disease, and Peter was discharged with a 3-week supply of antibiotics. In case you're wondering, yes, Peter made a full recovery. He even re-enrolled in my class and got a pretty good grade. The effectiveness of your voice rests in your ability to get your doctor to listen and hear you. But as we saw with the case of Peter, sometimes that can be difficult. For instance, the research shows that a doctor spends on average 15 minutes with each patient. In some cases, only 11 minutes. That's not a lot of time. However, in that same amount of time, in that time of a doctor's appointment, today you will leave with a 3-part prescription on how to effectively use your voice to get and stay healthy. It requires you to acknowledge the challenges in getting your voice heard, anticipate your experiences, prepare for those doctor's appointments, and finally, amplify your voice with story. Now, I'd like to spend some time on your first part of your prescription, the challenge of getting your voice heard. Now, going back to the 15 minutes that your doctor spends with you, that's not a lot of time. Studies show that during that time with your doctor, one of the things that's most important to patients is to explain why they're there, what hurts. The research shows that it takes the average person about 3 minutes to explain the nature of their visit. That same research shows that a doctor interrupts you 12 seconds in. It's hard to get your voice heard if you're being interrupted and cut off. In addition, it's not uncommon for doctors to walk into exam rooms with their laptop. Your electronic health records have become permanent third parties to the conversation you're trying to have with your doctor. As they scroll through their computer screen, checking appropriate boxes, try to maintain eye contact while staying engaged with you requires a set of multitasking skills that can drown out your voice. Short doctor's visits, doctors interrupting you, the presence of technology. These challenges may make it easier for your doctor to hand you a prescription than to have a 10-minute conversation with you about lifestyle changes to promote better health, or to ask an unscripted question that they fear could lead you down a journey of a 20-minute segue down memory lane. But what's the cost? What's the cost of those unasked questions, of those unspoken conversations? If you're not talking, if your doctor isn't listening, if those conversations aren't being had, the research shows that increases the possibility of your doctor coming up with a wrong diagnosis, ordering a test you don't need, of you leaving your doctor's appointment without a complete understanding of what your diagnosis is, or without full buy-in into your treatment plan. So that brings us to the second part of your prescription. How do you use your voice effectively to maximize the 15 minutes you have with your doctor? Well, like for my talk here today, think about your audience. Your agenda may not be the same as your doctor's. His goal is to zero in on your primary concern. Yours may be to go through your laundry list of ailments in no particular order, no matter how small. A more effective approach might be to identify your top 1 or 2 concerns. If you have more, write them down and bring them with you to your appointment and ask your doctor to help you prioritize what makes sense to deal with at this appointment And what might better wait until your next appointment? For those concerns, have specific questions. The more specific your question is, the more detailed and explicit your doctor's answer will be. Now, you don't have a lot of time with your doctor. Anticipate their questions and have answers ready for them. Also, it's not uncommon that at the end of your appointment, you think of several questions you'd like to ask. At that point, your doctor has a choice. Answer your questions briefly now, perhaps at the expense of good clinical care, or schedule another appointment. Use your voice and make the choice for them. Schedule another appointment. And if that appointment's not soon enough, ask about email communication through a patient portal. Your voice can take many forms, and email communication is an effective way to deal with after appointment and in between appointment questions. Now, I'd like to go to our third part of your prescription. What happens when your voice isn't heard? Not because your question has been disregarded, but because the words aren't coming out. Now, this can happen for a number of reasons. It could be because of the magnitude of the appointment. It could be because of embarrassment or cultural factors. Or, as in the case of my father, a chronic non-complainer who was never asked the right question. My father was a career Army officer, and since retiring, he's experienced a host of medical issues. He was diagnosed with chronic myeloid leukemia, had back problems that necessitated 2 surgeries. The pain in my father's back and legs has made his ability to walk around the house unassisted very difficult. However, you'd never know it from his doctor's appointments. Colonel Boyd, how's it going? Oh, I'm feeling pretty good. How's the mobility? Won't be running any 4-minute miles, but you know, I'm doing all right. And so it went, year after year, with unerring consistency. Until finally, after watching my dad try to move around my parents' house, as I watched his scope of activities get smaller and smaller, I reached the tipping point. Now, I got to tell you, I'm sure there's a great TED Talk in here for when an adult child figures out that they need to take the caregiver reins from their parents. But seeing the note cards that they're holding up in the back, today's probably not the time for that. Suffice it to say, that tipping point finally forced me to have that frank conversation with my dad. And during that conversation, I asked the one question that apparently wasn't in his doctor's script. Dad, what do you want? And he admitted that he wanted to be able to walk in to my grandmother's 98th birthday unassisted. However, he was afraid that the pain in his back and his legs would make that impossible. I went to my dad's next doctor's appointment with him, and several more after that, to give voice to what he wanted, to tell the doctor his story. Instead of getting another prescription for tramadol for his pain, we got a walking and swimming training program. Now, all of this didn't unfold in one appointment, but over several appointments, we put a plan in place. That was 8 months ago. On February 12th, my grandmother turned 98. My father walked in unassisted to bring her her flowers. If you can't give voice to your words, bring someone with you who can, a loved one, a friend, a patient advocate. Doctors need to know what's important to you, and the presence of someone else can raise the level of expectation, and doctors will respond in kind. And I can't stress enough, tell your story. Doctors need to know what's important to you. If you rattle off a series of symptoms, hey, my shoulder hurts, doctor, I need an MRI. Not memorable, not riveting, not informative. Instead, try the story. My brother had cancer that spread to his bone and shoulder. I'm worried about the pain in my shoulder. Or in the case of my father, I want to be able to walk in unassisted and hand my mother flowers on her 98th birthday. Your voice is your single most powerful medical diagnostic tool to get and stay healthy. Use it.